Hello and welcome, everyone. Welcome. As you are logging in, go ahead and stay muted, and we're about to start. And the chat is open, so you're welcome to be active in the chat during our presentations here, and then the last half of the session will be our Q&A, our live Q&A. So I'll just get us started here. So I'm Megan Kingsley Gale with the Hospital Handbook Project. The Hospital Handbook Project is hosting today's session, and this session is part of a longer series that we host that's called the Issues in Hospital-Based Practice webinar series. So today's session is on Medicare, the Social Security Act, and acupuncturists. And today is Wednesday evening, April 14th, 2021. And this is our live Zoom session. And like I said before, this is hosted by the Hospital Handbook Project for acupuncturists and their hospital sponsors. Our website is below there. And welcome. I am Megan Kingsley Gale. I am the founder and director of the Hospital Handbook Project, and this is a volunteer position. And a little bit of an outline of how we are set up today. We'll have an introduction, some information about the Hospital Handbook Project, and background on how this event came to be. And then today's session, just wanted to be clear that we will not be talking about Medicare billing, but I will tell you, for those of you, because there was a high interest in this, where to find the resource for the Medicare billing discussion that we're having in the Hospital Handbook Project community. Just to notice that this session is being recorded. And then, of course, at the end of my slides here, I will be introducing our guest speaker. So I believe that patients have the best access and greatest potential for team care coordination when integrative medicine is available where they receive healthcare. So what is the Hospital Handbook Project? So I won't go into the full presentation today. I'll just give you some of the highlights, but I highly recommend those of you who are brand new to the Hospital Handbook Project's work, or if you've been following our work but haven't seen our latest presentation yet, I did create a new presentation at this link, and this link is also in the chat. And it will be in the follow-up materials for this session as well. I recommend just checking out that 20-minute presentation. It is a much clearer presentation of what our goals, mission, and vision is, especially for 2021 and beyond. So who and what is the Hospital Handbook Project? We are the go-to resource for hospital-based acupuncturists and their program managers, hospital admin. We are a not-for-profit community resource project and a professional networking community. We discuss issues in practice and share innovations, solutions, and more. So just to clarify some language, when I say hospital-based, as the Hospital Handbook Project, this is how we define what hospital-based means. It means, I'm using the broad definition of it. So my definition of when I say hospital-based, it means someone who's working in a facility or organization that is accredited by or eligible for accreditation by the Joint Commission. The Joint Commission is a nonprofit quality assurance and safety vetting organization based in the US. It accredits a variety of organizations, including hospitals, ambulatory centers, facilities, county clinics, federally qualified health centers, federal health facilities, the Department of Defense, the VA, Indian Health Service, et cetera, and some hospice organizations. So our core focus in our vision is that we are the go-to resource for hospital-based acupuncture work, employment practices, and program standards. Our specialty is that we are a professional network community of hospital practice acupuncturists, clinicians, program managers, and more. So our vision is to support healthcare organization employment to be available as an employment option for licensed acupuncturists, to become the one-stop professional networking resource for hospital-based acupuncturist employment and program standards, and to be a resource for acupuncturists and program managers and connect them to resources, program examples, to share ideas, innovations, and help avoid the problem of reinventing the wheel. Become the one-stop resource for standards, examples, and professional networking related to hospital-based practice acupuncture or hospital-based acupuncture practice on hiring and retaining employees, what does success look like? Answering that question, such as, what does success for a functional rehabilitation pain management program look like? Or what does success look like for an inpatient acupuncture service, as well as clinical metrics for program managers. Our vision, we're working on becoming the authority on hospital-based employment best practices for acupuncturists and hospital-based acupuncture program standards. So we are a not-for-profit community resource project. As you saw in some of the materials when you registered, the suggested donation for today's session is $25. You can do that by subscribing to this month's Issues in Hospital-Based Practice webinar online resource module, which is $25 at that link. Or if you prefer just like a one-time support option, you can do the $25 support option by way of the virtual coffee support option on the website. And that's, you'll see that under when you're at the website under the support the project, you go to the website, click on support the project, and then you'll see this icon for coffee. And so you can support in different amounts of coffee. So again, the suggested donation for today's support is $25. So why today's session? As the LORAC said, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So I have been interested in inclusion of acupuncturists in federal legislation for a while now. And what I have found is that when you're working in hospital-based practice or healthcare system practice, you will eventually come up to this issue of like, well, why can't we do that? And often what that comes down to is, well, you're just not included in that language, or you're not included in the federal legislation language that is that. And today we're talking specifically about Social Security Act and how that affects Medicare. So this, as many of you know who are here today, the Medicare decided to cover acupuncture for low back pain in January of, I think it was January of 2020. So please correct me if I have that date wrong. And so this fall, there was interest in the group. There's some confusion about how coverage was working. So I said I would host a community discussion session in November of 2020. And my background is, besides hospital-based practice, I have a background in medical records and then as well as I helped to write the documentation standards for the Washington State Workers' Comp pilot project for documentation of acupuncture for chronic low back pain for the workers' comp return to work model. And as well as I have practice writing documentation standards for the functional rehabilitation model for Army acupuncture pain management. So I thought at the November session, I would just talk about what those documentation standards were. But what I learned when we had that session is that there were more complicated things, like it didn't come down just to having a standard operating procedure and following that and following all the documentation protocols. There was more of a question of like how the language of Medicare coverage of acupuncture for low back pain was being interpreted by different Medicare contractors. And so what's good about having community discussion is that you get to talk about and have discussion and then find that you can narrow some of the questions. So if you can come up with good questions, it's easier to find answers for those questions. So the November discussion just brought up more questions that came up with the common issue that kept coming up was we need to look into like actually being recognized in whatever laws are involved that where Medicare recognizes acupuncturists as a provider. Because everything else, especially with the new coverage, is this really awkward workaround, which we knew, some of us knew that was coming, but this coming out was just like, okay, yeah, this is, even more of a workaround than unusual, unexpected interpretations of it and inconsistency. So I knew Kallie, our guest speaker, Kallie Byrd Guimond, was an expert in, or is an expert in federal legislation. So I invited her to come talk about how federal legislation works and how that's related to licensed acupuncture. So that's what she's here today to talk with us about. And so I just wanted to talk about some common themes. So when everyone was registering for the session today, some common themes I noticed in the questions you have for our speaker. So what is the legislative process, which Kallie will cover. Current Medicare coverage, billing issues, developing an SOP, language, etc. Charting and documentation, standards, evaluation and management codes, and credentialing. So those were common themes in the questions. Kallie's focus today is talking about the legislative process. Just wanted to note from all those registration forms, I know tonight we have representation tonight from all these different aspects of people working in healthcare and hospital system practice and how, so I know all of you are coming to this with different, different populations of people that you work with, but the Medicare issue and coverage by Medicare is a commonality that we all have. So we've got several hospital systems that are represented tonight. We got program directors and managers, as well as hospital-based acupuncturists. We have people working in children's hospitals. We've got colleagues working both inpatient and outpatient here today, as well as hospice and colleagues working at federal qualified health centers, as well as those working in the federal system. All right, so just a note about the Medicare billing process, because we did have a lot of questions come in on that. We are not talking about the Medicare billing process today. Today's session is focused on federal legislation. However, we do have a separate discussion, asynchronous discussion session going on about Medicare billing process. So if you are interested in sharing your success story of how your program is billing Medicare, or you want to learn from others, and so you can join this session. So if you're a hospital healthcare system acupuncturist program manager, so this resource is only for those of you who are working in hospitals or healthcare systems as an acupuncturist or program manager, only for that group of people with the Hospital Handbook Project community. You are welcome to join our ongoing discussion that started when we had that live session in November of 2020. So so if you're interested in that, just send me an email and I will send you the link. And we're really looking for people who do have success stories to share your success stories so others can learn and just share how things are working out and what has been successful, what has not been. It's just a nice wisdom share so we can all grow and learn from each other. So some ground rules for today. Stay muted as a default, and that just helps cut down on the feedback and improve sound quality for the recording. Please go ahead and use the chat. That is a great way to communicate while the speakers are presenting. When we do get to the Q&A session, please raise your hand, use that raise your hand feature when you have a question. Be respectful of the speakers. Notice that we are recording this session. I don't know if this recording will be available later, but I will at least create notes from this session. And when we do get to the Q&A session, go ahead and introduce yourself when you're prompted. Give us your name, where you work, like if you're outpatient, inpatient, federal qualified health center, that kind of setting, and what your role is in that setting. So without further ado, our guest speaker today is Dr. Kallie Byrd Guimond. She is the principal at Sustainable Influence. She has been a government affairs professional for over 20 years with a focus on integrative health policy. In her work, she has overseen national conventions, congressional briefings, and management of legislation at both the federal and state level. She has experience with direct lobbying, presentation of testimony, bill drafting, grassroots mobilization, shepherding legislation, and legislative tracking. Sustainable Influence is an organization dedicated to leveling the policy playing field by teaching organizations and their members the most effective grassroots and grass tops techniques Sustainable Influence organizes and oversees federal fly-ins and state lobby days, as well as providing guidance for handling state and federal regulatory policies. Okay, so I'm going to pause here and we will just switch over our slides and listen to Kallie. So welcome, Kallie. Thank you very much for being here and presenting with us tonight. Thank you.
Wonderful. Okay, so who I am. I am a 25-year government affairs professional. I work with several state acupuncture associations. I used to sit on the board of the American Society of Acupuncturists and help them while I was there hold their first congressional briefing on acupuncture and opioids, and their first congressional fly-in, in which we were attempting to get co-sponsors for Judy Chu's bill in a different congressional session. So next slide, please. We're going to dive right in. Whenever you're ready. There you go. Oh, let's go back one, if we could. Thank you. Well, there we go. Okay. Most people, when they think of the Social Security Act, probably think about taxes. And it is a huge tax bill, a piece of legislation that definitely addresses it, but it also has a tremendous amount to do with our healthcare system. So what did the Social Security Act, which was passed in 1935, by the way, and had several amendments along the way, what it did for healthcare is it created a public health service and created funding for that and allowed the Surgeon General to be able to allocate funds directly at our public healthcare system. And it created later, with amendments, it created both Medicare and Medicaid. I've got public health and Medicare capitalized, and the reason is that is actually addressed in Judy Chu's bill. Whereas Medicaid is a state program, as most of you who work in hospital systems know, and many of you who are licensed acupuncturists are aware as well. We won't be addressing Medicaid today unless I talk about block grant funding that comes down through the federal government, but I don't think we're going to have time for that. So next slide, please. How did we get here? Megan touched on this. In December of 2019, I believe, we started, we knew that CMS, the Centers for Medicaid and Medicare and Medicaid Services, was going to start looking at the evidence-based studies, and that they were going to consider covering acupuncture for chronic low back pain, very, very specifically. And so they did issue guidelines, and within those guidelines, we saw some issues. We'll just put it that way. Next slide, please. So the way that CMS will say that they got here is very, very simple. It's the way that most of the federal government views acupuncture, and that includes our military and our VA. And that is the opioid crisis, which, by the way, did not go away in the pandemic, and it's certainly gotten, it's garnering a lot of attention again these days. What CMS said is right there on the screen, but I'll just read it to you, although you will find that I'm an off-the-cuff speaker. And by the way, I do want to encourage you guys to use your chat function. Please don't raise your hands during this presentation, because I get easily distracted, but I will absolutely talk to you at the end of it. And if you put anything in the chat function, I told Megan I will answer any questions you have and send them to her, and she can distribute that. So what the CMS Principal Duty Administrator of Operations said, Operations and Policy, is we are dedicated to increasing access to alternatives to prescription opioids, and believe that covering acupuncture for chronic low back pain is in the best interest of Medicare patients. We are building on important lessons learned from the private sector in this critical aspect of patient care. over-reliance on opioids for people with chronic pain is one of the factors that led to the crisis, so it is vital that we offer a range of treatment options for our beneficiaries. And they are correct about that. Although I will say that it's not just in the private sector. Our military learned that even though their uh, they did not want their active military or their veterans to be in pain. What they were doing in trying to take away their pain was also putting them in a position where they were easily addicted to something so highly addictive, and it wouldn't allow them to function. And so they suddenly had and possibly contributed to and may have added a huge amount of people to our opioid crisis. Next slide, Megan. It's all in the definitions as we're looking forward. Every time you start to see the word acupuncture or acupuncturist, we are defined differently. So I have some of these up here. And like I said, I'll include links so that everybody can see. But essentially, what you're looking at on the screen are different ways that acupuncturist is defined federally. And, and that's also from a legislative and a regulatory perspective. So what does that mean? It means that at least we have a definition coming for us, although that's new. We have our NCCAOM to thank for a BLS code, which is a labor code. So we as licensed acupuncturists do have a labor code, which is imperative when you're trying to get covered in the Social Security Act, because if you don't, it just makes it harder. Um, and then there is this definition coming out of CMS. But we are actually being defined as auxiliary healthcare providers, essentially, auxiliary personnel, and not as licensed acupuncturists. So when they came up with their guidelines, it's very clear that they are talking about us because the requirements for being this auxiliary personnel are things like graduating with a 3-year master's from an ACOM accredited school. And for those of you who don't know what I'm talking about, ACOM is the accrediting body for our schools in the field of acupuncture. And it also talks about the certifications. And so there were a few things that happened when they came out with guidelines. There were lots and lots of commentary from both inside of our field and outside of our field regarding these guidelines. And there were two specific things that we addressed over at the American Society of Acupuncturists. They did a fantastic job and continue to do so. So I have a huge shout out moment for them and their state associations. We focused on the fact that we really wanted to be defined as licensed acupuncturist. Why? Because when you're moving forward in research, you want to be able to point to us as the practitioners who are actually in these studies. And so we didn't get that, unfortunately. We were still defined as auxiliary personnel. That's something that I think we will continue to harp on as we move along. And it is something that's going to happen if we can get this particular bill passed, because there's way more recognition for licensed acupuncturists if we are actually covered in the Social Security Act. What you can see here is a highlighted appropriate level of supervision. It's the second thing that we harped on, and one way that we actually did get something that we were looking for. And that was that originally what it said is direct supervision from the MDs. Physicians is what it says, and then it goes on to further define physicians. And it included people like nurse practitioners and physician's assistants. And the problem with that, no disrespect to our colleagues that are nurse practitioners or physician's assistants, but it set us back because we are autonomous in the states. We do not require supervision. We worked very, very hard for that. We are the experts in our field, and nowhere in history has it been, is it consistent with state law that we would have supervision from physician's assistants or nurse practitioners. So it was inconsistent. So unfortunately, they did not remove that part, but they did change it from direct supervision to appropriate level. Now, with that definition, we sought clarification as well, and we did not get it. Unfortunately, when you call CMS, which kudos to Megan for reaching out and inviting them, we have invited them to several conferences, and they haven't. They have not joined us yet. I have been a part of a conference that did manage to get them there, but they got someone who really was just assigned to make sure that healthcare costs were quite low, and so unfortunately, we didn't get a lot of the answers that we were looking for. Um, but in this instance, we did get it changed to appropriate level of supervision. And unfortunately for us, that's where CMS stopped. And so this vague way of looking at things, we had members of Congress reach out, specifically Judy Chu's office was highly interested and pursued this regularly, only to be told that they've taken it as far as they possibly can with the guidelines. And if we want something different, then we need to engage in a different tactic, which would be changing the legislative mandates and trying to tackle it that way on a federal level. Next slide, please. Why be a part of the system? I get this question from acupuncturists all the time, and I'm so hopeful to get back to in-person presentations because Zoom calls are actually harder for me to connect with my audience and see if they um, can be interactive with me. So I usually start my presentations by asking a room full of acupuncturists who wants to be a part of the federal Medicare system. And usually about 20% of the people, 20 to 50%, depending, on what part of the country I'm in and how old the practitioners are, because let's face it, the younger ones or the ones that are coming out of school right now are hundreds of thousands of dollars in student loan debt sometimes. And whereas the older practitioners are not, or the ones who have been practicing for some time are not. Um, so they are more interested in being a part of these federal programs. They need more job opportunities, and this would provide a path. Um, the second thing that I ask them is who would be interested in being a part of student loan forgiveness programs. 100% of them raise their hands. And then I asked them who would be interested in seeing acupuncture expand into mainstream environments in which we could develop and implement residency programs. 100% of them raised their hand and think that would be good for the industry. However, when I asked them, who do you think funds that? They don't know. And the answer is CMS. CMS actually funds 95%. I mean, there are private residency programs for sure, but 95% of them, that funding is coming out of CMS. And for anybody who doesn't know what I'm talking about, and this is for the licensed acupuncturist, I know the hospital administrators know that I'm talking about residency programs that are in hospitals. So the last part of this is that the reason that you would want to be a part of it is acupuncture is now a part of the system. The minute that they decided that they were going to cover chronic low back pain, it was a part of the system. And so we are not a part of the system. Like licensed acupuncturists are not a part of the system. And this is something that I mentioned to the ASA years ago. And that was ultimately, we are going to have CMS cover and federally acupuncture will be covered, but licensed acupuncturists will not. And so here we find ourselves at the crux of exactly what I was worried about. And so the other issue is that physicians and non-physician practitioners, which right now they are not covered in with this guidelines because they're not graduating from ACOM accredited schools. They are not even with let's say chiropractors. There is guidance from CMS that states essentially that even though chiropractors are listed as physicians inside of the Social Security Act, they're limited to spinal manipulation. And so they don't actually qualify under these guidelines either. They do recognize that dry needling is considered a form of acupuncture, which acupuncturists have been sort of fighting nationwide. And some states they've been successful in, other states they have not. And so, but they also issued a statement saying that they understood that um, there were uh, private insurers who did not recognize dry needling at this point. And at some point, and we'll cover this more at a symposium where we're talking about, we will have Amy Major speak up about her experience with the CPT, the current procedural terminology, in which, again, ASA has been fighting the good fight for a very long time. And so we're really, really proud of them. Um, I skipped over the fact that you want to increase access and exposure. And for a lot of people, for licensed acupuncturists, the reimbursement rate is so low that they can't make a living doing this. And it doesn't get any better at a federal level. And it certainly isn't great at a Medicaid level. And an example of that is that a licensed acupuncturist in the state of California could needle every 15 minutes, but they're only going to get paid $8 for each 15-minute period. So given the cost of living out in California, it makes it almost impossible to offer your services to people that desperately need it, absolutely desperately need it. And so you have to understand that for many people, this is going to be their only access to acupuncture. And we want to, I've never met an acupuncturist who didn't have this wholehearted um, altruistic goal of really bringing this beautiful medicine. I know there are people here who are going to consider this modalities. That is not how we see it. We see it as a system of medicine because that's what we learned, and that's that's the way that we're going to see it. Now, for federal work, I've always told them you have to understand that that part of educating people is something that we're still going to have to do, and that they also need to not sort of be in a vacuum, because while we are surrounded by people who know about acupuncture and love it because our patients love it, we have to recognize that there's still so much work to do to expand the pool of people who are keenly aware of acupuncture, and therefore to increase awareness will also increase the desire for those services. That being said, lots and lots of other practitioners have been steadily along the way adding acupuncture to their scope of practice because they understand that it's so useful, from MDs to chiropractors to physical therapists. It can, unfortunately, keep us engaged in a turf battle. However, I think that ultimately the best way to go is to be in an integrative mindset in the same manner that Megan talked about earlier. Next slide, please. So another reason to participate in a legislative activity right now is we are beginning to see that the problems we anticipated by the vague responses coming out of CMS are now a reality. I got I got 3 pages today of an acupuncturist's elderly patient who was submitting to Medicare on their own. And the truth is, if you go into the handbook provided by CMS, which is Medicare and You 2021, on the first page and on page 30, it will tell you that acupuncture is covered. The sad part is it doesn't tell you that licensed acupuncturist must have some appropriate supervision. And since the jury is out on what appropriate means, um, much like when you deal with one VA, you've dealt with one VA. In this instance, we have several people who work at CMS in their billing departments who have said everything from, we don't cover acupuncture, which is inaccurate, to they really don't they certainly haven't read the guidelines, and they don't have, believe it or not, they don't have the policy efficacy to know how to respond to that. I will give you an example of policy efficacy just from a hospital standpoint. I just recently spent 6 days in the hospital with COVID, and and I am uninsured. And they were about to hand me a six-figure bill, which is terrifying. But as it stands, in the CARES Act, they do provide through HRSA for hospitals to apply for a grant that's being offered, so hospitals do not have to leave money on the table right now for the uninsured, because 100% of our treatments are covered. That's what the relief package actually offered. And so fortunately, given my policy background, I was able to pull the case manager aside, who then told the head of the hospital, who talked to the billing department. And in my community now, they are now aware. The hospital wasn't, and there are many large hospital systems who probably are, but in my little town, at my local hospital, they don't have the money, and in the past have not needed to hire a policy expert to read through thousands of pages of a relief bill in order to determine where they are affected. But they were grateful because now they can serve the community and not feel like they're harassing people for large scale bills. Okay, so what happens? It takes an act of Congress. You hear it all the time, right? And so, Megan, I'm going to ask you if you are able to click on that video link. And if it doesn't work, we'll turn the camera off for a second and I will share my screen, and I can definitely show this video. So tell me if that works for you. I want you guys to hear from Judy Chu directly. She made this video for me, but she made it so that people could hear from her about this bill.
Hello, I'm Congressmember Judy Chu from California's 27th Congressional District, and I want to thank you for taking the time today to learn about the ways in which you can advance the profession of acupuncture and integrate it more fully into our healthcare system. I have worked closely with the acupuncturist community for many years, and it's been a long road to get to a place where acupuncture is not only accepted, but respected as a safe and effective and proven form of healthcare. From legalization in California to increasing the minimum number of training hours needed to inclusion in workers' compensation and now to federal recognition of this proven and effective practice, I have been proud to help advance the field of acupuncture. And it has only gotten more important as problems like the opioid crisis created a need for safer alternatives. Last year, just before the pandemic hit, we had a great victory in acupuncture. The Center for Medicare and Medicaid Services, or CMS, announced in a national coverage determination that it would, for the first time, cover acupuncture for chronic lower back pain. This is a huge step forward in acupuncture finally being recognized for all the incredible benefits it provides. Unfortunately, while the CMS decision recognized acupuncture as a service that Medicare can cover, licensed acupuncturists still cannot be considered Medicare providers in their own right. That will take an act of Congress, which is why I will be introducing my bill again, the Acupuncture for Heroes and Seniors Act. This bill would add licensed acupuncturists to the list of eligible Medicare providers, ensuring that if a Medicare patient wishes to receive acupuncture treatment, they can do so from the provider most qualified to do so. My bill would treat licensed acupuncturists just like any other non-physician Medicare provider, allowing them to participate in the program if they want to, but not requiring it. My bill also goes a step further and requires Medicare to cover acupuncture for a minimum of 13 separate conditions, from chronic pain to cancer pain to symptoms relating to PTSD. We know acupuncture can do so much for so many people, which is why I have introduced the bill year after year. I plan to reintroduce my bill this coming spring, but to get it over the finish line, I will need your help. We need more people to know the benefits of acupuncture because right now so many in Washington, D.C. do not understand how much acupuncture can help their constituents. So this is why I turn to you. You as acupuncturists can be the most powerful advocates if you visit your members of Congress and tell them from your personal experience how much acupuncture can help people with conditions like chronic pain and arthritis. It is through your advocacy that legislation like this can become law. I look forward to continuing to work with you all as we help to make quality acupuncture accessible to everyone, regardless of their zip code, income level, or insurance coverage. Thank you.
Her legislative director, what they want you guys to understand is they are in the middle of trying to continue with relief packages, and that they're actually just coming back into session on the Senate side. And so there's a lot going on. And it is not that they did not want to be here, but in fact that they couldn't. And so that video, again, was created directly for Megan and for me, and can be distributed to the rest of you soon. So what does this act of Congress do? And by the way, I was hoping by April we would have a bill number, but the truth is, I think most of you are aware that we've had some issues in DC since January 6th. And so it hasn't, normally we would have seen an introduction in February, but we were not able to get one yet. We do think that it's coming very, very soon. And so don't pay attention to the bill numbers. They're from a different congressional session, the last one. But I am giving you the bill numbers because for now, the language hasn't changed. So, and there's a history to this. Judy Chu has been at this for a very long time. Congresswoman Chu, I believe this is her 4th introduction. She has worked really closely with several members of the acupuncture community, several national organizations. And while we can be very tribal, and I would encourage all of them to not be very tribal, she has not been. She will absolutely meet with any acupuncturist that wants to talk to her. And Ellen Hamilton, her legislative director, is so lovely, and she will answer any questions. She always responds. She is probably, for me, the most reliable member of Capitol Hill staff that I've ever dealt with. So I highly encourage people that if you have questions directly about her bill and you want to talk to somebody, feel free. So what does the Medicare portion of this do? Because the large bill actually starts with the military and the veterans portion, which is significantly longer. This Medicare portion is short. So Section 7 establishes federal definitions. It talks about payment rules, and before you guys get super excited and think you can go find something about what you would directly be paid, you can't. All it does is talk about payment rules for the difference between Part A, hospital settings, which will be interesting to many of you, but it really is just about the definitions, and Part B, which is medical insurance. And so the EOB that I showed you guys, that is about medical insurance. So I don't know what it looks like if a patient were to enter a hospital that currently has an acupuncturist there. You guys would be the expert on that. Megan would be the expert on that. And I'm always interested in hearing about it, but ultimately my lane is advocacy. And so I can't help you guys with that. It does give an effective date, which is 270 days after passage. If you're doing math on that, that's 9 months afterwards, which feels like an excruciating long time when you have people who are coming to you in pain and we don't have anything resolved for coverage. But this is actually pretty standard. Anytime you only see things like 30 days or 60 days, it's usually a federal comment period, or it's something like a relief package in the middle of a pandemic that needs to get somewhere very, very quickly, where you're going to see these short turnaround. Section 8 provides a pathway for licensed acupuncturists in the regular Corps and the Ready Reserve Corps of the Public Health Service. It also establishes that at least 6 of them need to be appointed, and it gives regulations, mandated regulations for what that looks like. Next slide, please.
Just wanted to give you a heads up, Kallie, that it's about 7 o'clock.
Okay, well, and I don't think, yeah, this is, trust me, we're almost done. Okay, so this is a tale of two bills. We have the large bill. I say very large. It's ridiculous. It's not even that large. That was HR 1183. You're more than welcome to look at it. It includes TRICARE, veterans, and and it's 8 sections, and section 7 and 8 is the Medicare bill. And then we are so fortunate that they're also going to pull out the Medicare language. And so it was the veterans bill that we ran in the last session. This time we're going to run the seniors bill, or the Medicare bill. And the reason we didn't do that before is that the regulatory agency, CMS, didn't cover it. In fact, when we passed the Support Act, which was the opioid package, we had to first establish what the barriers to acupuncture was, and we knew what it was. It was that CMS didn't cover it. So we had to actually spend a whole year to make that determination, even though we knew what it was. So what people need to understand is, when you run legislation, if you don't have the backing of the regulatory agency, that bill is dead on arrival. So there was no way we were ever going to run a seniors bill knowing that CMS was just going to come back and say, we don't cover it. Next slide, please. All right, the path to passage. Many of you asked how we do this. So what you do is, we have to have co-sponsors for Judy Chu's current legislation. We need what's called a CBO score, which is the Congressional Budget Office, and all they're going to do is an analysis of what it would cost the federal government to implement this program. And fortunately for us, the acupuncture community has done a tremendous job of analyzing this, and it literally looks like pennies to the dollar comparatively for what other programs would cost the federal government to implement. We need a hearing in whatever committee it's going to be in, and that's going to need to make it through that hearing, and then it needs to make it to the floor for a vote. And then we need a companion bill on the Senate side. We can run those simultaneously, and there would have to be in markup some way of making sure that those bills are similar. It's harder to get the Senate right now to understand how important this is, because historically the Senate side has not been the acupuncture champion that Judy Chu is. And so the ASA was very, very influential in getting Shaheen's office to run the veterans portion of the bill. And what we hope is they'll be successful in getting them to run the seniors bill as well. Next slide, please. Your timeline. State advocacy, for people who do that all the time, they will tell you that state advocacy actually takes about 4 months from start to finish, usually to implementation and signage by a governor. Federal advocacy is a marathon versus the sprint of state advocacy. This is year 7 for this particular bill. And we have a lot of work to do just to get all of the things that I just said. So it may not happen in this session, but I am more hopeful than I have ever been. Because of the opioid crisis, we are on the map. Because of people like you who are expressing interest in helping us get this done, so that you can offer these services and have licensed acupuncturists in that community, because why wouldn't you want to hire the experts in the field? I think that will have significant movement this year. Next slide, please. So how do we do this? One of the things that we've done is we've created something called Accu Congress, and this is not a trade association. This is a movement. So we want to work with everyone at this point. And we're not limited to, as I told Judy Chu's office today, actually like 2 hours ago, Accu Congress is not tribal. And by hook or crook, we are trying to get this done. And if that means that we are reaching out to licensed acupuncturists or people who want to work with them or their patients, then or students of acupuncture, anybody who wants to help, we encourage you to do so. So we are actually looking at a district by district matching that we want 100% on, so that they can call and write and participate in the fly-in, and make sure that we add those co-sponsors and that we influence the Senate side enough to get a companion bill. And we encourage them to make sure that they understand that we also need that CBO score and we need those hearings. And so I am the director of Accu Congress. I have done legislative training. I've done multiple fly-ins over 25 years. And in fact, I have one next Thursday for 720 people. So we are looking for at least 535 because we want to match in every single office. And we will hold that federal virtual fly-in December 8th of 2021. It is included in the price of registration for licensed acupuncturists who are listening, and actually this is open to anyone who wants to attend, of the Atlantic Symposium. Just so people know, Megan Gale is going to be speaking on her hospital handbook project as well. We also have Jen Stone here, who is just a premier researcher, if not the premier researcher in the acupuncture. As a licensed acupuncturist in our world, we are just so lucky to have her. And she's going to be presenting a piece on research as well, because no matter what we do at the federal level, if you don't have the efficacy studies to back it up, you're going nowhere. And what we know is we have plenty of them. I do want to talk about a piece of Judy Chu's bill that we're going to look to change, and that is she's got a bunch of conditions that she's trying to mandate. That is something that I actually disagree with. You'll see that in her video, and I have been promised that there's going to be some discussion of it once we get to markup, but that it will be introduced that way. And that's because this bill is now 7 years old, and there was a time period where listing all of those conditions would have been a caveat for implementation of federal legislation. However, it takes so long to implement federal legislation that I'm afraid that if we put those things into law, then it will take us a long time to change it, when this could actually just be handled in rules and regulations coming out of CMS. And those other ancillary healthcare providers wouldn't be limited. It would just be for the licensed acupuncturist. So we want to make sure that we are able to sit down with Congresswoman Chu and see if we can convince her to maybe take some of that out, if not all of it. All right, so it's included in the price of registration of Atlantic Symposium. You can register separately for this fly-in. The pricing right now is $79 for an early bird special. It will go up in September to $99, and it will be $149 after the Atlantic Symposium. So because we have more limited time to train you. It does require training. You will get all of the materials. And if you come to the symposium, you'll get all of that also in person. If you are a state association member, we're signing collaborative agreements with you. And that means that your members who attend get 10% off, but also if they choose not to come to the symposium, then they only pay $49 for the fly-in. So it's a deep discount for them of $30, $50, and $100. Just by virtue of being a state association member, because we want to support our state associations and we want to encourage people to go through their state associations in order to take part in this. Next slide, please. And this is what I was talking about. So the Accu Congress is housed at the Atlantic Symposium. You can actually sign up for all of that right now if you go to atlanticsymposium.com. I will tell you that we haven't advertised it anywhere else. Jason Sargis is with us tonight, and he gratefully put it together so that we could go live in case there were people here who wanted to take part of it. But that's the link. If you want to sign up, you certainly can. We encourage everybody who wants to help take part in this fly-in and wants to help change this particular piece of legislation or pass this piece of legislation, to come and learn about how to do that. And also, we encourage people who are in hospital systems who want to network with licensed acupuncturists who are interested, highly interested in working inside of these programs. We have a networking reception that we're starting with that Sunday. And well, I was done. I knew I was done. All right, guys, if you need to have more information, by all means, then that slide is up there. All of this will be passed out to you guys, so you don't have to worry about that. And I'm ready for questions, Megan, if you are, so you can just we can stop sharing your screen and people can raise their hands or ask whatever they need.